Hello, Dr. Amers here, and in this lesson we will talk about the functions of the back, which are support, movement, and protection of the nervous system. If you have any question, you can email me here at amar@goodrational.com or comment your question down below. The musculoskeletal elements of the back supports the body weight, but how? It carries and positions the head. It transmits forces through the pelvis to the lower limbs, like when you're carrying subject, lifting thing, or even your body weight during standing or walking. All these forces are transmitted through the pelvis to the lower limbs. Finally, it brace and help maneuver the upper limbs. How? With moving the vertebral column, it gives space to the more skillful movement of the upper limbs to be done. Now, the vertebral column, which is positioned posteriorly in the midline, when viewed laterally, as you can see here in this picture, it has a number of curvatures. The cervical, concave backwards, the thoracic, concave anteriorly, lumbar concave backwards, and sacral concave anteriorly. The primary curvature, which is concave anteriorly, reflects the original shape of the embryo, which is still retained in the thoracic and sacral curvatures in adults. Now, the secondary curvatures, the cervical and lumbar, they are concave posteriorly. They are of great importance. They bring the center of gravity into a vertical line. This is the vertical line you can see here. They bring the center of gravity into the midline, which allows the body weight to be balanced on the vertebral column in a way that expends the least amount of muscular energy to maintain an upright bipedal stance. This way, where the center of gravity is positioned in the center, not anteriorly, not posteriorly, the body and muscles of the back consume least amount of energy to maintain an upright position. But if it is more anteriorly, more posteriorly, as you can see in kyphosis patients, lordosis patients, or as stresses on the back increase from the cervical to lumbar regions, lower back problems are seen. Because of muscular tension to maintain an upright position. Now, movement. There are two groups of muscles in the back: the extrinsic muscles and the intrinsic. The extrinsic muscles of the back move the upper limbs and ribs. However, the intrinsic muscles maintain posture and move the vertebral column. These movements include flexion, extension, lateral flexion, and rotation. Movement. The amount of movement between any two vertebrae is limited, but as vertebral column move as a whole, as a unit, the amount of movement is additive. In cervical region, the first two vertebrae and associated muscles are specifically modified to support and position the head. The head flexes and extends in nodding motion on cervical one. A rotation of the head occurs as cervical one vertebra moves on the cervical two vertebra. Let's talk about the protection of the nervous system. The vertebral column and its associated soft tissues of the back contain the spinal cord and the proximal parts of the spinal nerves. The more distal parts of the spinal nerves pass into all other regions of the body, including certain regions of the head and all other organs.